Hello, we are the Sustainable Healthcare Group at Brighton and Sussex Medical School. We've been working over the last few years to create research to inform what we should be doing to make our health systems better in terms of planetary health. We've been undertaking education, both at undergraduate and postgraduate level, to expand knowledge amongst our colleagues. And we've also been trying to lead policy change using what we know from our research to push this agenda forward towards planetary health.
In terms of education, we've been working for the past few years to embed sustainable healthcare teaching into our undergraduate curriculum. For medical students, outcomes for graduates from the GMC now includes specific learning outcomes on sustainable healthcare, so it's essential that these are included. We've also been part of a national working group who have produced the first nationally endorsed curriculum for medical students on planetary health and sustainable healthcare. From the postgraduate point of view, we are launching a postgraduate certificate in medical education. We also, for all healthcare professionals, have an annual conference called the Share Conference, which is free to attend and online. This attracts a large number of delegates from several countries and serves as a really good event to share learning, to network and to collaborate with others in the field of sustainable healthcare.
So here at BSMS, our research focuses on providing an evidence-based approach for the transition to sustainable healthcare systems, looking at both environmental and social sustainability. And the research focuses on understanding that problem, but also thinking about how we might be able to bring about change, including how we might overcome some of those barriers and the enablers that we might use to transition to more sustainable healthcare systems. And on the environmental side, this very much uses carbon footprinting and life cycle assessment measures to evaluate the environmental impact across a whole variety of different clinical settings and scales. So, for example, this ranges from individual products, as well as looking at supporting processes such as sterilisation and waste, all the way through to whole patient pathways and surgical operations, right the way up to national scales, for example, looking at the national provision of PPE. And on the labour side, we also look at evaluating the labour rights abuses associated with the healthcare supply chain. And so that's really looking at the problem space. But on the solutions side, we then use that carbon footprinting and life cycle assessment to evaluate ways to actually reduce environmental impact. For example, looking at applying circular economy principles to look at ways to optimise processes and systems. And we also look at the financial models that might support that shift towards sustainable healthcare systems, particularly to reusables, for example, looking at managed service contracts and servitisation. And really importantly, we think about the behaviour change that might be required and how that might be brought about so that we actually make those real world reductions. Another key area that we're looking at is the role of digital care pathways and the role that might play in us actually shifting to more sustainable healthcare systems. We also undertake research that might underpin how we might bring about change in terms of both policy and regulatory processes. And we're delighted that our research has been recognised this year within the Planetary Health Report Card as actually ranking top in the UK for research within sustainable healthcare.
So some of the other work we do here is about policy engagement and policy change. We've worked with government both in the UK and broadly, in particular with our interest in supply chains. So we've worked with the Greener NHS in England to map how procurement works, both in terms of regulations and practice in the real world, so that we can enable change in the way that we buy products. We've also worked with government to support their changes to recognise medical products as a particular high-risk category for labour rights issues, and that has come into legislation, as well as work at European level, where that has also come into legislation. In fact, we have an international working group that we helped to set up that's looking at these sorts of issues in supply chains around the world because we recognise the need for a global response. Related to that, we also need to understand what is it that drives these linear economies for medical products. So in working with infection control experts, both nationally and internationally, to try and bring some evidence and, to be honest, some common sense to our views of perceived risk of infection. Beyond that, we're also engaging at the coalface, and we are engaging with specialties, in particular, to start with surgery, myself being a surgeon, and surgery, as you may have heard, being a particularly carbon-intensive activity or surgical care. What have we done? Well, we supported in 2022 the release of the Green Theatre Checklist, a checklist of a number of evidence-based recommendations on what you can do in the actual operating theatre. And further than that, in 2023, we chaired and helped support a green surgery report which tells the surgical community what we can do to green surgery, from care pathways, from public health engagement, from reducing what we use in the operating theatre. We are hopeful that this sort of engagement at a specialty level, at a particular medical specialty, could be emulated and supported for other specialties, both action in the UK, but also internationally. Following on from this introductory talk, we have another series of talks that give you some background to some of the information and the work that we have been doing in this field, and we hope that it may help yourself and others to spread this word and to join us in our ambitions.